We have been saying it's not a matter of if, but when that we would find Omicron in our state, and that when is today. We have been preparing for this moment. Today, the Washington State Department of Health is announcing 3 different cases of Omicron in 3 different counties of Washington: King, Pierce, and Thurston. Washington becomes the 13th state across the nation to confirm Omicron within its borders. And as you know, it has been found in at least 38 countries. Most of the cases in the United States have some travel associated with them. While there is a lot we are still investigating, here is what we do know. The genotyping results came back, were confirmed midday today. We know that the individuals whose results came back today range in the age from 29 to 39, 2 males and 1 female. We found these results due to our increased genotyping efforts here in our state. As you heard us say earlier in this week, that was a key driver for what we were going to be doing as we continue to watch and monitor for Omicron in our state. Here's what we do not know. We do not know yet information on severity of disease or hospitalization at this time. We also do not know the travel history for these individuals as of yet. That, as well as vaccination status, are key details that we expect to learn more as we continue our investigation efforts in the coming days. So it is early, but we felt we should share as early as possible with you, the media, and our community. When we do know more, we will certainly update and share with you. As we've been saying this entire week, Omicron is a reason for concern. However, it is not a reason to panic. Washington was primed to find it quickly, our state as a whole and all of our partners together, and that's what we did. Omicron is highly mutated, but as we know, Delta variant remains the dominant variant in the state of Washington. It remains to be seen if that will continue or change, or how so in the near future. The next few weeks will be critical in determining how this variant spreads compared to Delta. We absolutely continue to monitor that as well as continue in our investigation. As you know, we have been emphasizing throughout the tools to fight COVID-19, whether Omicron, Delta, or any other variant. The best ways to prevent the spread of this new variant or any other variant is, of course, to get vaccinated. And that's for both adults and pediatric children. That's for primary vaccination for those who have not gotten vaccinated yet, as well as boosters for those eligible. And we certainly want to continue to emphasize wearing masks and other safety protocols, especially indoor public settings or in crowded situations. That is especially the case as people travel and also the holidays right around the corner.
Been saying this week, we were highly confident that we were going to be able to detect this variant in Washington very quickly. And it has turned out that Washington is ready for this. We've been prepared, and our preparedness efforts really have allowed us to find these cases we're talking about today. Prioritizing cases, and when we get these cases that we investigate them and we find out who the contacts are, we call that case investigation and contact tracing. And these are some of the highest risk folks that we know, those that have traveled from countries where Omicron is present, in these labs where there's S dropout, and anyone who's been identified as a close contact to Omicron case. These are really where our efforts are going to be right now. So for the public, it really means when the public health department calls, answer your phone. It is critical for us to get to the tools that we know that work, such as isolation or quarantine, to help us limit the spread of this. I don't think any of us feel that we're going to stop the spread of this. This is clearly already here, but these are things we can do to limit the spread.